We have a couple of acronyms that we use to help us remember what can go wrong with someone that would cause a change in their behavior or an altered mental status. First one is AEIOUTIPS. If you run through these, A is alcohol, so if someone has taken in too much alcohol, they can have a change in behavior, change in mental status. We oftentimes see it with someone that has a history of seizures with epilepsy. There's in that postictal state afterwards. We can also have environmental things, like someone that is hypothermic or hyperthermic. Their temperature is too low or too high. Electrolytes are just going to be imbalances with sodium and potassium and a few of the other electrolytes, and that can also cause changes in mental status. Insulin, for this one we think diabetics, and most of the time we think hypoglycemia, although hyperglycemia or real high blood sugars can also cause a change in mental status. O is overdose, oxygen, and opiates. So overdose, which opiates sometimes could fall under that too, but have they taken something? Have they overdosed on some medication? For oxygen, with hypoxia, a lot of times the patient will get anxious or restless, and as their oxygen levels drop, they become more sleepy and obtunded or unresponsive, so oxygen levels could also be a factor. And that's actually an easy one, somewhat easy for us to fix. Make sure you give them oxygen. And then opiates, and we put this one separate now because so many people are overdosing on narcotics, and if you see someone unresponsive with a slow respiratory rate and pinpoint pupils, we tend to think opiates. Now, in addition to overdose, somebody could actually be taking too much of their medication, or having too little of their medication. They could be underdosing themselves. And sometimes we see this in patients that maybe can't afford their medication, so they're not taking them or only taking them every other day instead of every day. And then also uremia. And this is a little bit harder for us to maybe imagine, but I think many of us have seen this if you've ever done a dialysis transfer. So on Monday, Wednesday, Fridays, we take our dialysis patient, or Tuesday, Thursday, Saturday, and if they go every day, they tend to do all right. But if they miss a treatment, miss a day, or even over the 2-day weekend, they have some changes in their behaviors, and they're just not quite the same person after 2 days as they are after 1 day of missing a treatment. So as these toxins build up in the blood and they don't get taken out through the kidneys or through dialysis, we can have a change in mental status. Now, trauma kind of makes sense. Someone gets hit in the head and they can have a concussion or a cerebral hemorrhage or contusion and bruising to the brain and have a change in mental status. And we put toxins in here, and some people will also consider this as overdose. But if they've been exposed to something that's toxic to them, that can cause a change in mental status. Infection can do it, and we think primarily meningitis. So if somebody has a history of a severe headache, a stiff neck, running a fever, and they have a change in mental status, we think infection. With P, we think psychosis and poisons, and poisons and toxins and overdose and underdose, I know kind of all go together, but some people find it easier to remember if we put it under the P. And then psychosis, and remember, we're looking for any causes of altered mental status or change in behaviors. So we could have some manic depressives, we could have some schizophrenics that have a change in behavior, and that would fall under psychosis. And last but not least is the S, and stroke can do it. So look for facial drooping, unequal pupils, a slurred speech, and weakness on one side of the body. And late stages of shock, we have anxiousness, restlessness, and then unresponsiveness. Now, epilepsy with E also is covered here under seizures, but maybe they don't have a history of epilepsy. Maybe it's a secondary seizure, and this is the first time they've had one. Sepsis, severe infection, again, you can think of that under the I, or you can put it here under S. And then did they have a syncopal episode? Now, the other acronym that we will use, here's again a review of all the AEIOU tips. But the other acronym that I've seen, and this comes from Wilderness Medical Associates, Wilderness Advanced Life Support courses, where I learned it, Stop Eats. And I'm not as big of a fan of this one, and I don't see as many people use this one, but just in case you come across this one. So for Stop Eats, we start with S, and that's sugars. So could they be hypo or hyperglycemic? Could they be hyper or hypothermic with their temperature? Could it be an oxygen level again, usually hypoxic? Pressure, and with pressure, this one is a bit of a stretch for me. But here we tend to think brain bleed from trauma or stroke, or maybe even some high altitude cerebral edema, where we have swelling of the brain. Those are all pressure things. Electricity, which seizures kind of fall under electricity, because that's kind of, some people will say that that's an electrical storm in the brain. Altitude, as we go up in height, and usually above 6 to 10,000 feet is when we begin to see this. We'll see changes in pressures, and then we'll have the HACE or HAPE, and HACE is high altitude cerebral edema. HAPE would be high altitude pulmonary edema, and here we have brain swelling or fluid on the lungs if we have something that goes too high. Toxins, and this could be any sort of the medications or exposure to something. And then finally salts, which would be electrolytes, which definitely in a wilderness situation is a concern that maybe somebody isn't drinking properly or eating properly and doesn't have enough sodium, potassium, and other electrolytes in their system. So again, here's the STOPEATS, not used as much as AEIOUTIPS, but it is another acronym out there. And I hope that these two acronyms will help you remember what can cause a change in mental status, and once we have figured out what is wrong with the patient, we can begin treating them.